All right, what happens when you put the Senate's only Democratic socialist and President Trump's ultra-conservative budget director in the same room to discuss the president's new budget? Well, you don't want to miss this. Watch.
Bottom line is, tell me, let me get back to one question.
Sure.
Why do you think the Walton family needs a $52 billion tax break?
My guess is that you're basing that assertion on the only tax detail that we have in the budget.
The repeal of the estate tax. Exactly.
Right. And if we want to have a talk about why we're repealing that, I'd be more than happy to do that.
Good. Let's tell me.
Because ordinary people are paying more.
No, ordinary people do not have a wealth of $128 billion. That's not an ordinary person.
The average increase across this nation since
You're not answering the question. The question is, answer the question. The wealthiest family in America gets a $52 billion tax break as a result of the repeal of the estate tax.
That's correct.
Tell the American people why you think that's good when you cut Medicaid and you cut programs for kids.
Again, we don't cut Medicaid. We're talking about repealing Obamacare. The results
Throwing
that you
23 million people off of health insurance. That's right?
Which is a CBO number that I think you just agreed could be wrong at the outset.
I didn't agree to that at all.
Okay, so we got two big stories going on this week. They're both related, so I want to recap President Trump's budget for fact's sake. Let's take a look at this right now. The winners under the budget are going to be the U.S. military, border security, and law enforcement over 10 years, which is the way I like to look at budgets, the way that budget forecasters like to look at budgets. We're seeing a $500 billion increase in these types of things. Okay, $500 billion. Keep that in mind because the cuts total $3.3 trillion. Medicaid programs are being cut, despite what you heard Mick Mulvaney, the head of the Office of Management and Budget, say. Welfare programs are being cut. Other non-defense areas are being cut. 66 government departments are going to see cuts in total of $3.3 trillion over 10 years. Now, I'm moving to health care, right? ACA is Obamacare versus Obamacare. Under the new health care bill, by 2018, there will be 14 million more uninsured people. By 2020, 19 million more uninsured, and by 2026, 23 million more uninsured. Here's another way to look at this. If we had stayed with Obamacare, ACA, by 2026, there would still be 28 million uninsured people in America. It did not fulfill its goal of getting everybody insured. Under the new plan, AHCA, the American Health Care Act, Trump Care, if you want to call it that, by 2026, there will be 51 million uninsured people. You heard Mick Mulvaney say in response to Bernie Sanders, we're not cutting Medicaid. I'm going to tell you about that in a second, but let's talk about insurance premiums. By 2018, the premiums under the new health care bill will be 20% higher than under Obamacare. By 2019, that acceleration will slow down. They'll only be 5% higher. And by 2026, they'll be 4 to 20% lower than they would have been under Obamacare. This is really important to remember. Doesn't mean premiums will be actually lower. On average, they will increase at a slower rate. I'll give you another way to think about this. By 2026, under Obamacare, insurance premiums should have slowed down their increase to the point that they were increasing 5.5% per year. It's still higher than inflation. It's still a lot, but that's what it would have slowed down to. Under the American Health Care Act, by 2026, that increase will be between 4.4 and 5.3%. They're still going up. They're going up at a slower rate, and the insurance that you will get for this money in some cases will not be the equivalent of the insurance that you might have gotten under Obamacare. And here's the other big one. $834 billion is being cut out of Medicaid. This is important to remember because before Obamacare expansion of Medicaid, there weren't that many Americans on Medicaid. We have increased this number dramatically. 14 million fewer people will get Medicaid. So in rural areas of America where an entire hospital depends on the fact that it's Medicaid funded, you might lose the entire hospital.
Large swaths of Trump country, so to speak.
That's correct.
What CBO just told us is the reforms that we put in this bill will help lower premiums. And so I'm very encouraged by that. But I think what members are frustrated with is what's behind the CBO analysis about who gets insured and who doesn't get insured. If you leave it up to a person's choice, then they'll make a choice. If the government's going to stop forcing people to buy something that they don't want to buy, then they won't buy it. And that's basically what CBO is saying. And I think the lack of clarity on that point is what has members frustrated.
That is a remarkably interesting spin. So the reason why there will be 23 million fewer people with health insurance is because, as Paul Ryan says it, if you don't force people to buy health insurance, they have the freedom to make the choice not to be insured with health coverage.
I want to go back to something that Mark Sanford, congressman from South Carolina, said to me last hour on MSNBC with regards to the CBO score. He took issue with this idea that there would be millions more uninsured. He said that part of the reason that was the case is because the CBO was saying that folks would be uninsured when in fact they would just have less insurance than they would otherwise under Obamacare. Is that true?
No, actually, in some sense, he's making his own argument against himself, which is what CBO says is 23 million will lose insurance, literally zero.
Altogether.
Altogether. On top of that, come the comments just made, many people will see much worse insurance. So that 4 to 20% premium decline you're seeing, that comes from two components. First of all, insurance getting much worse. Second of all, sick people getting kicked out of the market. So if you see the states where premiums will decline 20%, those are the states where they're kicking sick people out of the market. So sure, if you don't give insurance to sick people, rates can come down, but that's not a gain. So really we're saying you're not comparing apples to apples. On an apples-to-apples basis, this law will raise premiums. It will only lower premiums because people are going to get worse insurance and sick people are getting kicked out.
For those buying their own insurance, the GOP bill would mean some significant prices increases for a lot of older, poor Americans. For example, an individual making $26,000 a year, for those 64 years old and older, your premium could go up to a minimum of $12,000. $12,000. And again, we want to leave this graphic up for just a second so folks at home, this is from Axios, so folks at home can digest this information. But they also talk about $119 billion being cut out of the deficit. Is this something that's worth a trade-off, perhaps?
Well, look, let's look at the simple numbers. They're going to cut Medicaid, one of our most important social insurance programs, by $800 billion. They're then going to take another $300 billion out of other healthcare spending. So that's more than $1 trillion of healthcare spending cuts. And you get only a $100 billion reduction in the deficit. Why the difference? Because they're spending all that money in a huge tax cut for the rich. So there is literally nothing in this bill. Look, if they cut that and said, look, we're going to put it all towards deficit reduction, I wouldn't like the bill, but at least they have a coherent argument. There's no coherent argument here. They are literally taking billions from our lowest, most vulnerable Americans, not just low-income families. But remember, 2/3 of Medicaid spending is on the elderly and disabled. This is your mom in the nursing home. She gets paid for by Medicaid. That gets cut. So they're literally taking away money from our most vulnerable citizens, and they're not even really lowering the deficit. It's just unfair.